Good afternoon, everyone. This has been a busy and exciting few weeks here in Missouri. Yesterday, we welcomed Missourians from across the state to the Capitol to celebrate Missouri's bicentennial. And although it was a little warm, maybe a little hot yesterday, it was a perfect day to commemorate and share in 200 years of Missouri's rich history. The First Lady and I will continue our bicentennial tour across the state. We are also looking forward to the bicentennial inauguration parade and ball on September the 18th here at the state capitol. We encourage Missourians from every county and corner of the state to join us on September the 18th to help celebrate this special occasion. Today, we're excited to announce the new Dnr Director, but first, we want to provide a bit of an update on COVID-19 spread and other efforts to combat it. We do have some good news to share regarding the vaccine. Since first announcing our vaccine incentive program, over 200,000 COVID-19 vaccines have been administered throughout the state. This is nearly 50% increase over the daily and weekly vaccination rates we were seeing before the announcement. We are encouraged by the amount of attention this program has brought to the importance of getting vaccinated. We are also seeing more and more conversations between Missourians and their trusted medical experts about getting vaccinated. This program and resulting conversations have also helped generate more vaccine media attention based in fact instead of fiction. We are proud to announce that more than 450,000 Missourians have entered the Missouri Vaccine Incentive Program, VIP, and have a chance at winning $10,000 or college scholarship funds. Entries have come evenly from rural and urban counties across the state. And I do believe the first prize will be drawn this week, this Friday. The first $10,000 prize will be drawn. While we were making progress with Missouri VIP, the Delta variant continues to pose a serious risk to unvaccinated Missourians. COVID-19 cases and hospitalization are increasing. But the people ending up in the hospital with serious illness continue to be the unvaccinated. We understand that some Missourians are hesitant toward getting the vaccine. But now is the time to step up and take personal responsibility to protect yourself, your loved ones, by getting vaccinated. Talk to your doctor and other local health leaders to decide whether getting vaccination is right for you. Our continued efforts to get more Missourians vaccinated are ongoing and will take time. This is why today we are also announcing the allocation of $30 million to increase hospital staffing capacity and provide antibody infusion sites across the state. $15 million will go towards establishing antibody infusion centers. Antibody infusions are proven to decrease serious illness from COVID-19, and we have seen tremendous success with our site in Springfield. We are working with regional partners to identify high-need areas and establish these sites. We expect to be able to establish 5 to 8 sites and treat up to 2,000 patients per day across the state. Additionally, we know our hospital capacity is limited due to staffing shortages, not a lack of bed capacity. To help alleviate this issue, we will be allocating $15 million to contract additional staff. Every critical access and acute care licensed hospitals will have access to this program. Staffing allocations still depend on the number of licensed beds per hospital. It is our hope that this program will decrease hospital capacity strain caused by staffing shortages. and decrease the need for future alternative care sites. From the very beginning, we have supported our communities by following our Show Me Strong recovery plan, and we will continue to provide needed resources to our local healthcare partners across the state as we work to mitigate the impacts of COVID-19 and the Delta strain. We are hopeful that Missourians will continue to get the facts and explore every opportunity available to get vaccinated. Now, the reason we are here today. We know that selecting the next Dnr Director could be critical for the department and our state. Director Comer was a talented, spirit, and accomplished leader who left some big shoes to fill. We knew it was important to find someone who is passionate about Missouri and the department's mission, just as Carol was. We interviewed several highly qualified candidates that had some impressive credentials. But for me, it comes down to the individual and who they represent, and whether they are in this arena for the right reasons and can provide Missourians with the level of service that they demand and they deserve. Leaders in our administration need to be able to serve Missouri families like their own. That is why today we are announcing Drew Bruton as the new Director of the Department of Natural Resources. Let me try that again. Drew Button as the new Director of the Department of Natural Resources. Drew is an experienced and trusted leader within DNR and across state government. He worked closely with Director Comer and stepped up to be a steady hand of leadership upon her passing. We know Drew will honor Carol's legacy, but also that he has the determination and vision to move DNR forward. Drew is also a fifth-generation Missourian who carries a deep devotion to the state of Missouri. Drew has served as the Deputy Director of DNR for over 4 years. He has more than 15 years of experience with DNR and over 20 years in state government. Drew has led DNR's red tape reduction initiative as well as a drought response and flood recovery support efforts across the state. We are confident in Drew's ability and know he will continue to be a great leader. We look forward to his continued service to Missourians, and we are excited to see what all he accomplished in the advancement of Missouri's natural resources. I'll now turn it over to Drew to introduce himself as the new director and take a few questions. Drew?
Thank you, Governor Parson. First, let me begin by saying I'm humbled and honored to accept Governor Parsons' appointment to serve as Director of the Missouri Department of Natural Resources. Thank you, Governor, for placing your trust in me to carry out the important work of the department and to lead a team of dedicated public servants. As the Governor said, I come from 5 generations of Missourians. I grew up in Moberly. I love this state and its people. I am looking forward to bringing to this role my experience in working with the department's complex issues and building relationships with stakeholders across the department's areas of responsibility. Under Governor Parsons' leadership, I will focus the department's efforts on the following priorities: using compliance assistance as the most productive approach to achieving environmental compliance, supporting collaborative infrastructure efforts, including flood protection, water resources, drinking water and wastewater infrastructure, and improvements at Missouri's 92 state parks and historic sites, working with state and federal partners to bring more dollars to help Missouri communities thrive, and prioritizing open communication with our partners. We have a great team working at DNR, and I'm excited about what we can accomplish working together with partners across Missouri. Thank you, Governor Parson, and I also want to take an opportunity to reflect on the service of Director Comer. She gave me an opportunity to come back to Missouri as the Deputy Director of the Department of Natural Resources. And I will do everything in my power to honor her legacy and to lead this department in a way that best serves the state and our residents. So thank you.
Thank you, Drew. Let me just remind everybody, I know you got good questions for Drew, but also I meant to tell you that Robert Nodell is also here, the Acting Director of the Department of Health. He'll be here available for some questions, make a short statement as soon as we get done with the questions with Drew. So if you got questions for Drew, he's up.
Any questions?
I'll ask you 2 questions, Drew, if you're okay. First off, no offense to the governor, can you say your last name for us, please?
Drew Buntin, B-U-N-T-I-N.
Okay, thank you. And then
Yeah.
second off, since you've been in the department, what is something, you mentioned kind of what your goals are that you want to work on. Is there anything else within the department that you want to see changed? Maybe it's throughout the state of Missouri. Other than those goals, is there something physically that we could see different happen through DNR?
I think largely it's going to be about looking at some of the opportunities we have in front of us right now. As an example, the legislature, at the governor's request, approved revenue bonds for projects at state parks across the state. So the focus is going to be on managing those projects, bringing them home to completion. The same thing would be true in the other areas that I mentioned. You know, we had a tremendous accomplishment in Atchison County following the flood of 19 in bringing a diverse set of partners within government and outside of government to look at some of the challenges that our communities and landowners face from a flood risk perspective. And we were able to accomplish a significant project there that not only is going to provide better flood protection, but it's going to reduce impacts on the Missouri River in that area in future floods. So that type of approach in looking at some of the challenges facing our communities and looking at the resources we have, not only within DNR, but across state government and within the federal government, to look at how we can set our communities up to prosper in the future and make sure that when people and their children are making decisions about what they want to do and where they want to be in the future, that they have an opportunity to do that in communities right here in Missouri.
I was hoping you could talk a little bit about your approach to CAFOs. I just know it's something that a lot of either local neighbors or smaller farmers are concerned about, the environmental impact of operations like that. Can you just talk a little bit about your thoughts on that?
Yeah, sure. I've observed that debate for many years in the state. You know, what we are there to do is to implement the laws and regulations in Missouri designed at preventing discharges from those facilities. Much of the time, the things that come into play in the discussions as those projects happen have to do more with local decisions that have to do with zoning. You know, what we are there to do is to look at the law, look at what those laws are there to protect in terms of our water resources, and be objective about looking at those requirements. And I believe we have a strong record of doing that in the state, and I wouldn't intend to change that focus.
All right, thank you, Drew.
Thank you.
All right, Robert.
How are you? Any questions?
Maybe questions for Robert? This is kind of a housekeeping, Robert, real quick. So we're expecting the drawing on Friday. How fast do you expect media or even the department to be able to get the word out about who won? How fast is that turnaround?
Those results will be made public, but it will be approximately 2 weeks when those are made public, because there's a verification process. We have to verify that the winners are indeed eligible and that they meet the terms and conditions of the program. There will be a number of alternate names that will be drawn, and that way if an individual is drawn that was entered perhaps in duplicate or and was drawn twice, or if they're not a resident of Missouri or they don't meet the terms and conditions or weren't indeed vaccinated as they had attested, that we'll be able to adjust that. So it will take a little bit of time, but I I would venture to say that a number of the winners will be pretty excited about that and that they will be raising their hands as well. But we're excited. Tonight at 11:59 p.m. is the deadline to be eligible for that first drawing. And so I would certainly encourage each and every one of you to remind the public of that, to give them that opportunity to participate in this first round of drawings that already over 450,000 Missourians have entered.
Can you go over just the $30 million, where is that money coming from, and also for the antibody infusion sites, like for the one that you had already set up in Springfield? Is there any way to track, like, did all of those people manage to avoid hospitalization? Is that something that you're able to track for those patients?
We know that it is very effective, that the infusion procedure is very effective in preventing hospitalization. I will have to go back and talk to the facility itself to get that information, that they would be in communication with those patients, but we have not communicated directly with them. As it relates to the $30 million for infusion centers and surge staffing for healthcare hospitals, that will be money that we'll take from our CRF funds here at the state level.
Hi. So regarding the vaccine incentive program, I know Governor Parsons said you've seen 200,000 more vaccinations. Do you have a breakdown of where those people are getting vaccinated? Are they more rural areas? Are they still in the urban areas?
It has been very proportional to the population of the state, and it's been very proportional to the vaccine uptake that we've seen across Missouri. The one area that we have seen perhaps a disproportionate increase in uptake in recent weeks has been in southwest Missouri, in what we consider to be Region D, but we've seen them probably outperform the population level in that region. But around the rest of the state, it's been very proportional.
And then can you just really quickly explain the antibody infusion and how long that process takes?
For an individual, typically the monoclonal antibody infusions are for individuals that have been infected, that are positive with COVID-19, and in many cases have comorbidities or risk factors that would put them at higher risk for hospitalization, severe illness, or death. But those have to be administered before they would see severe illness. So they're referred typically by a physician to have that treatment taken, and my understanding is it takes for an individual about 3 hours to complete that infusion process. So the number of locations that we have and the number of stations at those locations can indeed be used multiple times a day.
With the additional staffing at hospitals, what's your level of understanding that there are people out there who are qualified to do this job, that are willing to take this work? Because it seems like it's not just an issue. It's not like there's all these nurses sitting around that have nothing to do but would take a contract job if it was available. How do you know that there's actually bodies to fill those spots?
The state has entered into discussions with potential contractors across the country that do have traveling medical professionals that do move around the country into surge situations, or where there is a severe event, whether it has to do with an infectious disease or hurricanes or other extreme events, that they come in and provide surge staffing. So we have been assured that those individuals will be available, if so contracted by the state and the healthcare partners locally.
Is there any concern that the Missouri State Fair might lead to an uptake in COVID numbers?
We're hopeful. We're hopeful that the fair will be operated safely. It is largely an outdoor event, which we understand that outdoor events are typically safer. We are providing vaccination opportunities at the fair, and there will be guidance in terms of how to conduct that in a safe fashion. But we are very optimistic that it will be a safe and successful event.
All right, thank you, Robert.
You bet.
Governor Parson? Just off of what Robert just said about those contracted employees, does that mean that these hospitals are going to be still working with Vizient? Is Vizient still a big part here in the state? Are any hospitals using Vizient as we speak?
I don't know if they are. I mean, Robert could probably answer that too later. We know the contract that we're doing will be new companies that we're also going to be contracting with, that are available out there. We know some of them are freeing up in other parts of the state, but we also know it's getting busier in other sides of the state. So, that's a competitive market out there too. So we feel pretty comfortable right now that we're going to be able to get those extra bodies in here in a short fashion. So we hope to have that in place in a very short period of time.
This is about Medicaid expansion. I got your press release today. How long is your outlook for the current amount of money that's in the budget for the Medicaid program? How long do you think it can last with the new enrollees?
Well, if you're talking about general revenue before you run out of the federal money, general revenue is not going to be able to last but 3 or 4 months if you have to really just go in and just get it all out of general revenue. We're still going to be able to use some money because we still have that in the system that's matching money with the federal system. But the reality is you don't have the appropriations authority to go out there and spend any more money than you got until the legislators come back and try to figure out what action they're going to take on that. So you're still, I think when you go back to the spring when we were talking about if the legislators did put that in the budget, how long was it going to take us in? I think you got to remember then we were saying it would take 2 months to implement it. Plus you're going to need additional employees to be able to do that and the software to get it done. So it's not something you can just flip on the switch and be able to bring everybody in the next day and say you're qualified. Now we may be able to get them entered and get them pending status, but it's going to be a little bit before we can actually verify who's qualified and who's not. And that's what's going to take a little time.
Are you intending to call a special session for extra appropriations authorities, or are you going to wait till January for
I'm not at this point. We don't see the reason for that. I mean, we got to evaluate this as we go through it and see where we're at. But right now, that'll be something I think the legislators will have to take upon and make a priority if they want to make it a priority in January.
So going off the hospital staffing questions again, how many hospital workers or just healthcare workers are you hoping the state will get to fill that gap? And what are you hearing from hospitals? What are they lacking right now? Is it nurses? Is it respiratory specialists?
Well, I think all along, all the resources we've put there, whether it's the infusion centers that we're putting there as a request to them, the new ambulance resources we're bringing in here, the respiratory guidance that we've waived and been able to got people in here to help. I mean, we've been doing that all along from the state level. I think it's going to come back to what do they need, and they're going to have to work with these companies. It's just like we're not going to send like 200 people in a hospital. The hospital's going to have to work with us to say, okay, this is the staffing I need and what's available, and then we got to distribute that around the state of Missouri. But I believe that there's going to be an opportunity for hospitals, whether rural or urban, to take advantage of this program that want to. It's going to be available there.
Governor, 21.5% of children 12 to 14 have completed vaccination. With rising pediatric cases and school starting soon, what's your concern for children?
Look, the concern every day is with COVID-19 or the Delta variant. It changes every day. I think we've been concerned with that, all of us have, for 19 months, whether you're in this position or whether you're in the healthcare industry, whether you're parents, the general public. I mean, that concern is going to continue to go. This variant is going to be here. And we got to deal with it both with the vaccine, with the unvaccinated, with school starting. I think, again, I'm going to go back to what I've said all along. I think the parents need to have a real say in what happens to their kids when they go into a schoolroom. And I think that responsibility goes back to the parents.
Do you have any opinion on masks in schools
Most certainly.
statewide?
Most certainly. And I think at some point, the people that have had the vaccine, that have had COVID, that have been tested for antibodies, and they've got it in their system, I think there needs to be a division between those people and the people that are unvaccinated.
At school as well? Is that what you're saying?
Yeah, for the kids that have been vaccinated, I mean, that's very few. And we're still talking about kids less than 12, that we're talking about. But, again, the local districts are going to have to decide what to do that. And we see that there's schools across state. Some of them are not mandating masks. Some are. And I think you're going to see that develop to go. So, again, it goes back to the parents.
Final question has to do with today on Twitter. Your office put out that your ambulance strike teams, 103 people were transported, and I know that was in the Springfield area. Even though we're going to have more help now, you're putting $30 million in. Are ambulance strike teams possible anywhere else in the state? Are you talking about ambulance strike teams in St. Louis or Kansas City, anywhere else?
And well, certainly we have, and we're already moving them out of the Springfield area to go to other parts of the state. So, yeah, we're going to be able to utilize that wherever we might need it across the state. So that'll just be on the demand and where that is. I would say you're going to see resources probably coming out of the Springfield area because I think that's starting to look a lot better down there than where it was. So we'll be able to take some of those resources to other parts of the states and just try to stay ahead of this thing as much as we can on that. All right, thanks, everybody. Thanks.